diabetes, and sometimes we don't know. They will provide the information. Dr. Humaira Mohsin, please. Hello. Today I'll talk about how with diabetes, you are supposed to look after your mental health because sometimes it's ignored and along with diabetes, but you do face some mental health issues. But if we are aware of it and we can recognize it and see the connection, we'll talk about it. There are three things we should focus our talks today. One, I said earlier, mental health is very important and it has very deep connection with it. Mental health and diabetes. I'll tell you what tips for managing the impact of diabetes on your mental health so that we know how it's affecting mental health issues and all that. And if I know I do have issues and problems, what resources are available, and what can I do as a patient or caregiver to look after our mental health so that our diabetes are not affecting our mental health. Not just our body, but our mind as well, because our body and mind has a deep connection. As you're looking at it, they both are equally important. You know, nowadays, a lot of people are talking about mental health, it's being emphasized. If your mental health is being affected, it's going to affect your body as well. And if it is affecting your body, it will start impacting your mental health as well. When I'll talk about, when you have diabetes, then you have mental health issues that are chronic as well. It will affect your mental health as well. When you feel nervous, you feel depressed, you are worried, you're thinking everything is fine earlier, then we have these problems. Then you can have these problems and have other health problems. And both things, they go together hand in hand. First of all, half we'll talk about it. What we talked earlier, it was all about health and your body, how you monitor it, how do you control diabetes. But I'm talking about your mental health. How can you have more information regarding that? The surveys that have been done over the years, one survey that was done only a year earlier, that was done in South Asian community, which is quite big now, especially in BC. It was a study done in diabetes. How does it affect mental health? When people were asked, then they said 43% people thought diabetes negatively impact their emotional well-being. We don't feel well, we have depression, and some people feel asthma and other problems, and it impacts. And 38% people said generally diabetes negatively impact their mental health. Then I'm not happy, I'm worried. And 67% said when people have diabetes, they feel lonely, they feel isolated, not talking to others, uh, you know, pulled away from others. There's so many other things people think about it, and people think, I have diabetes, I'm worried, who should I talk to? And they feel ashamed, embarrassed, and then we don't open our heart to anybody. And I'll say that sometimes depression and can cause isolation and pulling away from others and not socializing with others. And I'll explain in detail about this earlier. And 76% people said they feel being judged for their diabetes. So they feel that they cannot openly talk to their siblings, their relatives, their family. So they're worried, they're always keeping it in. Whenever you have something that you don't feel right, and sugar, have sugar, diabetes, hypertension, other problem, physical health, or you're thinking about if there's a loss, financial loss, and there's a process that you go through and different levels you go through. Some, first of all, there's a shock. You think, what has happened? And you are not willing to admit it. You're saying it cannot happen. So you're in denial after the shock. You're not doing anything for your treatment because you're not admitting it. And then after that, there's other symptoms. People are nervous, angry. What has happened to me? Sometimes you feel about yourself, about others, or about your fate. You get angry about all these things. And that's a phase. Then it goes further than that. Next time you think, what should I do? When you go to the market and somebody tells you it's $500, you said, no, 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 it's not 500, it's worth 300. You're bargaining. You're thinking, I don't want to take medication, even like for diabetes. People are afraid of taking medication. People don't want to take it. You're not talking to anybody, but you're worried. But if you take it well, think about it, then you realize that I should go to the doctor, and then you realize you have diabetes, and you have this chronic problem. Then you have depression. You're feeling sad. There's a sense of loss. That's affecting your health, your mental health. You can have all those feelings, and this is a normal process. When there's something new or something big that happens to us, we go through this process. If you understand that, then we'll understand it. After that, after passing this stage, then people start accepting it. Then they think, yes, I have this medication. It has been diagnosed. Doctor is saying that I should admit it. Once we accept something, what happens? Then you feel a little bit at peace. Then you think about moving to the treatment, taking precautions. Diabetes, we've been talking about this since this morning. You make lifestyle changes. You think, I need to change my lifestyle. I need to live my life differently so that my health can stay better. And sometimes we go back. Sometimes we go acceptance. Sometimes we have accepted it, but then we go back to depression. And sometimes people go through this process. And when people are stuck in a phase or cycle, then people are saying, there's some lacking in treatment. They're not able to understand it or fully, or they don't agree with it, or they don't admit to it. There's another thing after acceptance. Then you start taking care of your own health. You become responsible. You say, it's my responsibility. What can I do about it, my own health? And then you go on that journey for better health. Ministry, that's what it's saying, that take care of your health. But you are the best person to look after your own health. The doctor is going to understand one thing, provide you medication, but it will all help. But you're the one who has to take the medication. You have to take the exercise. You have to do the exercise. Mental health and physical health is equally important. And pay attention to that.
There are 3-4 things that also related to the diabetes. Those are the things linked to the diabetes. I have my notes here. There are some things we say like mental health, the psychosocial aspects of diabetes. We say your and the diabetes distress. You are distressed about diabetes, that you are diabetic now. You got diabetes. In the case study, people who are diagnosed with diabetes in 18 months, 33 to 50% of people experience distress. It's called diabetes distress. So almost half of the people they have this stress that, oh, I have diabetes. No, no, what, why I need medication? I don't know if the medication will work, or maybe it has side effects. So these kinds you have to understand. So the information will reduce your stress about diabetes. If you will ask questions to the doctors, then slowly you will try. So if there will be no answer, you will be more stressed. So to take information, use internet, so then it will be less, the stress will be less. It will not completely gone, the stress will not be completely gone, but it will be low. People who feel stress, how I will cope with diabetes all my life, this is a big illness, what I have to do, what are the things there should be, you should have to bring lot of changes. It will be hard in the beginning. Just keep in mind, if your car break down, you have to push it first. Two three people are there, then they can roll it on. So then after that, even if one person push it, it will continue to go on. So it's the same thing. Once you start medication, exercise, and exchange your views, then it will be difficult, but slowly it will be, you will be able to cope with it. There are healthcare providers, there is a team of doctors. Like today we are discussing it, there are professionals, so there will be different things that will help you to cope with it. There will be sometimes problem with the relationships, so we sometimes feel isolated, alone, we don't want to talk to anybody about it, like depression. So we will talk about the symptoms of depression when we go move forward. So sometimes there is a problem in the relationship. If we recognize those problems, we can solve them. Again, there are not one, two, there are 4, 5 professionals you should talk. So it's not easy task. So you have to do it. You have to admit it, but it could be done. It's not impossible. Some people deal with multidisciplinary people. There will be no complications, and then they don't have to suffer too much. There is a prevention that's possible. The third thing, people are very afraid of two things. They they have anxiety about being hyper or hypoglycemia. So the symptoms will tell you if you are hypoglycemic or hyperglycemic. There will be symptoms. So we have to there will be things that will be problematic, and we have to, but so taking information is easy. With the information, once we understand how it affects, then there will be less anxiety and the distress that's going with it. If some and person have other there is other incident, trauma in the life beside this, the person is in difficult situation. If there is a big, if you are dealing with a big trauma, other adverse experience, some has attack or something, earthquake or any other distress in life, if you were involved in that, you have some kind of trauma in the past. So any problem you have, if you are in that kind of situation and also have diabetes, then your distress level will go up. So there are psychologists, there are professionals, so then they will accept it, and how they can they will diagnose it, and then they will treat it. And physical stress that affects your body, again, tell your healthcare provider. If you feel stressed, they can ask you some questions and they will offer you treatment. Ask questions. That's why we are here, just to help you. We are here to answer your questions. people will ask you questions because it's their responsibility to understand your question, your issues, and then they will offer you treatments. There are three things. They are very common that are mental health disorders. On top of that is depression. Approximately people who have diabetes, 30% of people also experience diabetes related anxiety. Anxiety is in 14%, depression in 30%, and it's almost decently diagnosed people. This when they start depression, they feel helpless. They don't enjoy life, so they go towards suicide. Their rate is higher. Remember that there are stages, as I mentioned earlier. So once you get to acceptance, then the other things go down, because the period in the beginning is more stressful, because you have to do so many things and the person feels it's no use, and so that's why the person reach to this kind of behavior. There are services you can access. So most important is you recognize them, recognize these problems, recognize these things that they are happening to you. So it's not important that these things are just because of diabetes. There are other situations, there are other mental health issues that could be present. So in your past life or trauma or circumstances in your life, so all these things going to hurt you if you have diabetes or not.
And other mental health disorders, it can cause bipolar disorder, schizophrenia, and instead of type 2 diabetes. Spending money, not knowing what you're doing, and going days and nights without sleeping, unable to sleep. And earlier, you were able to do, full of energy and happier. And other one is like bipolar, and there's a depression. And sometimes there's a high mood and low mood, and that's what's called bipolar. Depression I have talked about earlier. Schizophrenia also, psychosis. Sometimes people don't have connection with the reality. They think somebody wants to hurt them. Their reaction is different. Their spouse is not loyal. There's no evidence, but they feel that's how it's happening. If things like that are happening, if anything is happening out of the routine, mentally you feel different, you should approach a doctor. You should talk to them. If they are special in their specialties in that, they will. Otherwise, they will send you to a specialist. And there are other things, especially in type 2 diabetes, it's 3 times higher. If you look at another population, it's not happening. But once you have diabetes type 2, then the chances are going up. And one other thing that's very important, that the medication is given psychosis or mental health, for to treat mental health issues. You think, look at the medication you're taking, if you're taking it for mental health, and what medication you're taking for diabetes. And if you have diabetes, you tell your pharmacist, and also vice versa. And how can you recognize depression? If you're feeling hopeless, helpless, lack of pleasure, you don't enjoy things that you enjoyed earlier, feeling tired most of the time, changes in sleeping patterns, you don't feel like eating, you changes in eating habits. Uh, Sometimes, it can happen due to diabetes, but it's really important to get it checked from the doctor. And having trouble making decisions, sometimes that can happen. That should check your medication, especially elderly, and ask your healthcare provider. Especially in anxiety, you feel restlessness, feeling of being tense or edge, irritable. It can also happen with the depression as well. Impatience, being easily distracted, difficulty concentrating, you're unable to focus on anything. If you're feeling those symptoms, if you're tense, and when you're really worried and unable to talk, and you're stuck, you're unable to breathe, feeling a lump in your throat and sweating, and all that can happen as well. And get your medical test done just to make sure you don't have the if you have the system. And it can happen to thyroid problems, and it can happen, and you can have anxiety and depression both at the same time. And if you're high, you can feel anxiety, and if you're low, your mood is low, you can have depression like symptoms. People look at symptoms, and sometimes it can happen to lack of vitamin D. And mind and body go hand in hand. We want to see if it's the right diagnose and what's the reason for these symptoms. And of course, first of all, go see your family doctor. It's very important to have a regular family doctor because they know you for many years and they know your body system. You can not just walk in. The walk-in clinics doctors, they listen to one thing, give you medication, but you go to a family doctor regularly, they understand your conditions, they know what medication suits you, what doesn't, and they know your background. And also psychiatrist, if you have mental issues or problems, you can talk to them. And if you're able to comfortably talk to your GP, you can talk to them. But if they feel like that you should go to a specialist, then they can send you to see a specialist. You can go to counselor or psychologist for therapy. Psychiatrist can give you medication for treatment, and counselor or psychologist, they can talk to you in therapy, especially in CBT is the well known. There's a research done. So much research been done that CBT can help with your diabetes and also with the depression, anxiety. And Fraser Health it's available through Fraser Health free of charge, and they can do individual and group therapy. And these are the common symptoms. I won't go in detail because I'm out of time. I just want to say, if you're feeling disappointed, discouraged, despair, or you're feeling overwhelmed, it's too much, I'm really tired, you're feeling tired. Most important thing is to accept it. One thing is, yes, it's raining, you accept it. And if you start thinking about it and getting worried about it, then you think, oh, I don't like rain. It's always raining for me. My day is ruined. And you keep thinking about same thing over and over again. You go in that vicious cycle. So make sure you have that. Nobody enjoys diabetes, but that's for sure. But acceptance helps. And after accepting, you need to know what to do next, how to move forward with it. Right? Thank you.